Thank you. Good evening, everyone. Artificial intelligence is going to dramatically change medical imaging over the next decade. And our company, Intelligent Ultrasound, is at the forefront of that change in ultrasound scanning and imaging. So you might ask yourself, why is ultrasound of interest to an investor? And the reason is that ultrasound is one of four key global medical imaging modalities that are in the market today. So first of all, you've got X-ray, high radiation, static, low cost, excellent for bone. Then you've got CT, where you're looking at, again, radiation, static, high cost, excellent for bone, and excellent for soft tissue. MRI has a very strong magnetic field, again, high cost, static, but excellent for bone and tissue. And then you have ultrasound. Now, ultrasound has no radiation, it's portable, it's low cost, it's excellent for soft tissue, poor for bone, but really good for this, the modern way of identifying and diagnosing patients, where you can actually treat them at the bedside, okay? And that means that you're seeing increasingly hospitals all around the world moving to an ultrasound first policy, where it's the first modality you go to see if there's a problem. And then if you identify there's a problem, then you pull in one of the other more specialist modalities. Now, one of the issues with ultrasound is that ultrasound actually is very, very operator dependent. It's quite a hard skill to learn, whereas with CT and MRI imaging, you've got a big machine, you follow a procedure, and you get basically a common replicable set of images that are captured by the machine. With ultrasound, it's totally dependent on the sonographer, on the operator that's doing the imaging. They drive whether you get a good image or not. If they move the probe and don't move it in the correct plane of view, you won't get a good image. And that means this real-time interactive scan needs to be trained. And so a hospital will put a lot of money to train its clinicians to the very highest standards. Once they've trained them, then clearly they need to scan as many patients as possible so that they can maximize that resource in the hospital. And then finally, also, they need to make sure they minimize any misdiagnosis. And those three things are all key to hospitals all around the world. And it's basically what we do as a company. We started in the area of simulation. We have a simulation division that teaches to the very highest standards using the very latest simulation technology, virtual reality, augmented reality, and we have a range of simulators that do that in all areas of the body, from basically the female pelvis up to the neck. And then 2 years ago, we expanded our business and we started a clinical AI division, which is all about focusing on using AI-based image analysis in the clinic. So supporting the doctor that's moved from learning in the classroom, he's now in the clinic, he or she is in the clinic scanning a patient, and we give software tools that will help them scan faster or scan better. So I'll explain what all that means. Start with the simulation division. So the simulation division is all about training to the very highest standards, and we have 3 of the world's leading ultrasound training simulators in the marketplace. This is Eve. Eve is an extremely realistic model, and we have a number of variants of it. So we have Scan Trainer, which is all about teaching obstetrics and gynecology. We have HeartWorks, which is all about the heart and lung. And then finally, a new area called Point of Care, POCUS, which is all about emergency medicine, intensive care, critical care scanning. So these 3 simulators cover the big key areas of teaching ultrasound. We sell them all around the world. We've sold nearly, I think, 850 simulators now into about 550 medical institutions in about 30 countries around the world. We started in the UK. We dominate the UK market in terms of obstetrics and gynecology. We're probably the biggest in the UK in terms of heart, and we've just launched, obviously, our BodyWorks product. And clearly, you can see there's a way to go there. There's a whole market to go after in terms of the BodyWork simulator. So we then expanded into the US, set up our own sales force, opened an office in Atlanta, and we have America's just recently taken over from the UK as our biggest market in the world. Again, very strong in ScanTrainer and HeartWorks, just started with BodyWorks. We've sold to over 250 institutions in the US, over 250 systems into about 150 institutions. But clearly, again, this is a massive market, hundreds of hospitals, big teaching schools, so a lot of growth is expected to come out of North America over the coming years. These two markets we sell direct, we have our own salespeople. In the rest of the world, we sell via resellers. We have a major reseller in China. It's one of our bigger up-and-coming growth markets. Again, mainly dominated by the HeartWorks product, but with ScanTrainer and BodyWorks starting to sell. And we are looking for that to be quite a big growth area over the coming years. And then in the rest of the world, we have 30 resellers that we sell, the Gulf, Russia, Europe, Australia, and this makes up the bulk of the rest of our sales. So a sort of fairly strong network to build upon with a strong product range, and that's seen us grow sales over the last 5 to 6 years. We sold about 5.3 million last year of the product. Our results will be out on March 26th, I think it is this year, so yeah, about a month away. And we've put an announcement, trading update, that the sales will be between 5.7 and 5.9 million for 2019, and we do expect that growth to continue. Currently, it generates all our revenue, but it also is a foundation for our growth in the AI side, because the simulation business has given us real credibility in the ultrasound market. We are recognized as being one of the leading companies in understanding how to teach people ultrasound. So when we announced that we're moving into clinical AI, especially in ultrasound, that gave us the credibility that we actually knew what we were talking about, and we had the potential to develop software that would benefit clinicians in the marketplace. So we started 2 years ago a business called, a division called Clinical AI, and that was based on an acquisition that we've made. We bought a small startup company from the University of Oxford, and that enabled us to start this Clinical AI division. And it's all about speeding up scanning and minimizing misdiagnosis. Now, we can do that because we have a world-class ultrasound image database. That is based on over 3 million ultrasound images that have all been graded and sorted. One of the key things with any AI learning algorithm is that the images are key, and you've got to make sure that those images have been properly sorted and graded, because that's how you're going to teach your algorithm to get it right. So we've spent a lot of time over the years working with the University of Oxford, a number of hospitals around the world, to build this image database. That's been combined with the academic expertise of a lady called Professor Alison Noble out of the University of Oxford. She's one of the world's leaders in ultrasound image analysis in real time. And when that's combined with the proprietary AI machine learning models that we've got, that has enabled us to develop 2 products that we're now in the process of bringing to market. One's called ScanNeve and one's called Anatomy Guide, and I'll talk about those now. So ScanNeve is all about providing real-time image analysis for obstetricians. And if any of you have been to a hospital when you've had to do a 12-week, 20-week, or 30-week scan on a pregnancy, the sonographer or doctor that's doing the scan will follow a protocol. And that protocol varies around the world, but broadly follows the same protocol. But in the UK, you have to get 7 to 9 images. In America, it's 23 images. In the rest of the world, it follows an ISHWAG protocol, which is more aligned with the American model of about 23 images that you have to acquire. Now, every one of those images, when you're taking them, this is an example here. So when you're scanning, you're looking for all the key parts of the body in the fetus to check if it's growing properly. You want to find out if anything's abnormal, and you want to find out quickly. So this is a schematic of the abdomen, and in the abdomen, it is mapping out, can you see these key structures? You've got to identify the abdomen looks like this, and then you've got to see, can you see the stomach bubble, the spine, the ribs both sides, the umbilical vein, etc. They must all be in the image you take. If you can't see one of them, that image is not good enough to diagnose from. And the point about ultrasound is that if you are very slightly out of plane, when you freeze that image and you miss one of those structures, when it goes to the radiologist or the senior obstetrician to review, they'll send you back and say you need to get the patient back in because that image is not good enough. There might be something wrong. So it's very important you get that image right. So we have taught our algorithm to basically recognize every structure, be able to sort them into all the key structures, using 400,000 obstetrics images, as I've said, that have all been graded and sorted. That then has been loaded onto an ultrasound machine, put into hospital to test whether it will then be able to identify everything and run in a clinical environment. So when the sonographer freezes the image, automatically in real time, instantly, our software checks, can it see all the structures? When it sees those structures, it then gives a pass to the doctor, the sonographer who's scanning. Now, it's a bit like having a consultant standing next to you saying, good image, now retake that image. So it really benefits anyone that's scanning in the early environment. The key thing was to see when you went into a hospital, what did sonographers and doctors actually think of this device that's really standing there helping them? Would they see it as a threat? Would they see it as something supportive? Would they not want to work with it? And importantly, when we put it into St George's Hospital in London, we put it into Bath RUH, the feedback was that actually when we listened to how they worked, how they ran, how they scanned, what feedback they wanted, and provided our software that did that, they really liked it. They thought this was a real aid to them. It helped them. It was supportive. It was great if you just started scanning. It was really good as a supportive tool. They gave us some feedback and they said, right, that's fantastic. We really like the way you've done this. I'll show you it working. But also if you could then take that product and automate it so you could speed up how it's done and actually make it a much faster way of working, we'd really like it. So the two products that we've then developed from that clinical feedback that we had, I'll show you now. So the first product, ScanNeve, this is it operating in St George's Hospital. I think it's running. It's running now. This is St George's Hospital. It's one of their lead doctors is scanning. The screen splits into 3 views. You see the image here. This is the doctor scanning the patient, and that's the image. This is ScanNeve working. He's trying to get a good view of the face. And to get the face, you need to have magnification right, nasal tip, nostrils, and upper lip showing. They all go green, and it'll automatically save it up here when he's frozen it. Okay. So next one is the spine. The spine, you can have a composite of multiple images. He's scanned here. You've got a sacral and lumbar view. It's going to save those up here, but it's not going to go totally green. It's going to go yellow because he's still got to get the thoracic and cervical views. He's moved the probe. He's taking another view now. When it recognizes those, it will automatically save them and it will go green. Okay? This is all happening in real time when they're scanning. This is the scanning the head. He's looking for the head. Again here, he can see everything except he can't get the CSP view, so he's going to move the probe to another part of the body, re-scan it. It's going to show down here, it's going to break up there. So now the CSP is in view. He's going to place the calipers. It'll all go green. It'll save it up there. So as I say, the sonographers loved it, but they said, can you make that faster? Can you make it analyze every slice of the ultrasound I'm scanning so I don't need to freeze the image? And you can see here, she's scanning a 20-week patient. She's not touching the machine, and the system is automatically recognizing as she moves the probe, can I see, that's a head, can I see everything in view? Save the image. And it's saving all the images as she goes along. So as you move the probe along the body, as the ultrasound is sending its the beam down and coming back, you're getting a slice, grayscale view. It's analyzing every element of that view. It's then saying, can I see a head in it? Can I see a femur? Can I see a heart? And it recognizes it automatically and saves it. So importantly, from a sonographer's perspective there, you really speed up the process. A 20-week scan can take 30 to 40 minutes. So anything that can save 10 or 15 minutes off that scan is a real benefit to a hospital. It means they can scan more patients a day. You have more throughput within the hospitals. In America, which is driven massively by revenue, it's all about more throughput so I can charge more money at the end of the day and get more revenue back in. And that's exactly what our software is aimed at doing here. So we think there's a real market for this product. We're seeing real feedback from these sonographers saying, actually, we would love this product, get it on machines. So our aim has been to sign up a deal with a manufacturer and get this embedded on ultrasound machines, which I'll tell you more about. The second product is called Anatomy Guide. Anatomy Guide does exactly the same thing, but for ultrasound-guided needling. If you go into a hospital and want to have an operation on your hand or your arm or your leg, instead of having general anesthetic, you can have a local anesthetic. So this is called a peripheral nerve block. It's done by injecting local anesthetic in near a nerve to suppress a sensation in a specific part of the body. The benefit of doing a local nerve block is you can have an operation and you don't have to have general anesthetic, so it's less risk to you as a patient. but it also saves the hospital money because it's a cheaper anaesthesia to do. Now, the issue with doing a nerve block is that the people that perform the operations are anaesthetists. And anaesthetists, their number one job is not ultrasound. They only do this for this particular type of operation. And in the UK, 5% of anaesthetists do 85% of nerve blocks. And we asked the 95% who didn't do it, and they said, it's because of the ultrasound. We don't feel that confident in the ultrasound. When you look at ultrasound, it's grayscale. I'm looking at veins and nerves. It's quite hard to see. So, I don't feel that comfortable. So therefore, we don't do them. We do less of them. Now, if a hospital could do more of them, it would save money. So the benefit was, can you give me a tool that helps with the ultrasound scanning element of this procedure? So that's what we did. It's called Anatomy Guide. It does real-time highlighting of the structures as you scan. There's a video now of it working live. So this is an adductor block. We then highlight schematically what you're meant to be seeing for the anaesthetist. There you can see the anaesthetist putting his needle in to the adductor nerve. That is what they would normally see. That is what they see with Anatomy Guide and activated. So you can see it's color highlighting muscle, artery, and nerve. So now it's really clear and simple where everything is. You can see the needles coming down here to get to the nerve. They're going to inject the anaesthetic, which then actually changes the shape of the nerve as the anaesthetic floods over it. And you've got a piece of AI-based software which has a real benefit that hospitals will pay for to put on their machines. So importantly, we've now got 2 products that we believe have got real commercial value, because the key with AI is you've got to find someone to buy it at the end of the day. It's no good just saying I've got AI for the sake of it. You want to have something that commercially people are going to buy. And we think we've got 2 products that is very applicable to. So the reason it's interesting is these are big markets. So the ultrasound market is worth about $7 billion globally. The AI element of medical imaging is expected to be worth somewhere between 3 and 8 billion pounds, depends on how you break down where preliminary diagnosis is and automated image diagnosis is. But huge markets in well-known areas with very big players driving change within them. So Canon's number 1 in radiology with Philips and GE, Women's Healthcare, GE, Canon Mindray, and then point of care, Sonosite, GE, and Philips. So big players in the market looking for product. And importantly, we've signed our first global licensing deal. Unfortunately, I can't say who it's with because we're under confidentiality. Clearly, once the product goes on the machines and is released to market, we'll be able to tell everyone. But it's a long-term licensing deal. It integrates our AI image software onto all their machines in this speciality. So basically, the customer will just have to purchase an activation key, and then they'll be able to turn on their software. But it will, importantly, be in all the machines. It will generate, for us, a very high margin royalty. We're expecting revenues from 2021. We expect these first machines to be in market second half of this year, and we expect more agreements to follow. And that's because when you look at what we're doing, we're trying to build a multi-platform, multi-license model here. So the green is the first products that we've basically signed licenses for that we're looking to bring to market. First revenue, H1 21. We believe the second product will follow something like 6 to 12 months afterwards. Third product, we expect to be in market and generating revenue in 2021. And then blue are all the variants of each of these products with a third platform that we've currently got in development. But the point being that we're looking to have between 5 to 10 licensings all paying us revenue every month, every year going forward. And that would dramatically change our whole revenue model and move us into being a very profitable company if all those different licenses would come off. So in summary, we were a simulation business. We said we're going to be the gold standard in that, and that's what we did. 3 products in the market, still there, currently generating revenue, giving us real credibility to the ultrasound manufacturers. 2 years ago, we said we're going to follow the doctor from the classroom into the clinic, and we're going to start and build an AI business. We're going to take a product that is very much proof of concept, and we're going to put it into clinic and prove that people can use this, and then we're going to sign our first OEM agreement. We did that. That agreement was signed last July, as I've said, and basically we then raised last summer £6 million, which was basically to take these products to marketplace and generate our first revenue. We're right slap bang in the middle of doing that. We're on target, and everything says that we will have these products that you'll all be able to see in a hospital from the second half of this year. After that, we'll expand into diagnostic AI, doing very similar things. And then finally, the last area is that we think that the players in this marketplace for medical professionals, when the technology of ultrasound becomes small enough and cheap enough that you can plug it into an iPhone and scan yourself at home, you might be able to do a liver scan, an automated heart scan, an automated carotid artery scan for stroke risk. And that anyone that is a player in the space we're in has the potential to be a player in that space. Those are sort of 300 million people marketplaces where you completely change what you're doing. We're not saying we're in that now, but we think by being the player in this space over the next 5 years, we hope to be a player in that space in the future. That is Intelligent Ultrasound. I hope you've enjoyed listening to it. Any questions, fire away.
Excellent. Thank you. We have a question just here and then one at the back. So we'll maybe go to this one and then to the guy at the back.
Thank you. How much more money are you going to need before you become cash flow positive?
Yeah, it's a good question. So, as I say, we raised 6 million. In the public domain, I think it's clear that gets us to the middle of 2021. We've always said we would need more money. We haven't said how much, so it's not in the market I can talk about, but that's because there's two ways of getting it. So one way is obviously we go to the traditional route we've done, which is to raise it by doing a placing. But the second way is there is possibly the opportunity that any of the manufacturers we sign deals with going forward pay us an upfront fee, then on the basis of any contracts we sign, we can raise the money from a bank. So it's not guaranteed that we have to come back for more money in a fundraising route, but we clearly will need more money in the future, but there are multiple routes that we could get it through, potentially. And we're constantly evaluating those and seeing what is right and at the right time.
Excellent. We had a question just at the back and then one more gentleman
Hi there.
near the front.
Just a quick question about the technology.
Yes.
Is the AI technology transferable to existing scanning machines, or does it need to be fitted to new scanning machines?
Yes, another good question. So the first, one product is all about, most of them are going to be on new machines, okay, because it's all about finding the right balance of processing power, GPU power, graphics cards, memory allocation, and working within the more modern machines as they develop and those improve. So if you look back at machines 10 years ago, they probably couldn't cope. One area that we are considering for the needle guidance product is that you could have that as a black box device that you plug into a machine, so it has its own processing power off board and processes everything in off the machine, but delivers it on a second screen that you plug into the ultrasound machine. That is a possibility that we are exploring, and that would open up the ability to sell into a retrofit market. Yeah.
We've got another question just here.
Yeah, it's about revenue forecast for 2021 and 2022. You put up the bar charts, but I couldn't quite make out what the...
That's because there aren't any. So we're not allowed to forecast because we're a listed company. The analyst forecasts only go for 2020 at the moment, and 2020, the analyst forecast says 7.3 million. Now, that is just from our SIM business. We're not expecting revenue from our clinical business in 2020. There aren't any figures out for 21 onwards because of the early stage nature of the AI products not on machine yet with pricing, etc., that would give a sort of clear, accurate analysis of what 2021 is. But at some point, second half of this year, I would expect you'd be able to see those.
Another question.
Targeting hospitals, you've effectively got a fixed market size. Do you have anything going forward that would allow you to diversify your revenue streams once you begin to saturate the market for ultrasound?
So I think, I think one of the things is we have to be honest, we're a small company. And although we'd like to imagine that we could be a big company, the ultrasound market is a huge market. If we tried at the moment, I think, to say, yes, we're going to go into X-ray or MRI or CT, where you could take some of the things that we've done and, in theory, then develop devices that would do the same thing with AI in the field of X-ray, there are lots of players in that space, and we are still a small company. So I think by focusing on ultrasound, being a specialist in ultrasound, it's still a massive market. All our shareholders will be very happy if we were a big player in that marketplace. And I think that's the right strategy for us at the moment, is to stay where we are in ultrasound, where we are the specialists.
If there's not another question, can I just ask, could you expand a little bit on the regulatory process? You kind of, I think it's hinted at in the presentation.
Yes,
but.
so yes, I probably didn't say enough about that. So from a regulatory perspective, from a simulation side, there is no regulatory process. You're allowed to training doesn't require regulation. However, the AI side does. So our products would go through regulatory procedures. So the US, that will be FDA. We are working on those right now. And so I think the first products are at the, I don't want to curse what I'm doing, but they're at the easier end of the FDA. You know, we're not doing something that's going to be a danger to someone. The first products are really just saying you've got an image and it's a head and it meets a protocol, but the operator's still in charge of it. They can still reject an image. They can add any image themselves. So actually, we think we're at the easier end of FDA CE approval, but the targets would be we do CE and FDA first, and whatever the UK then has to do to meet the similar standards. And then following on from that would be CFDA, JFDA, etc. From the first products, we expect to be bringing those through with the manufacturer, doing the regulatory. But if we were doing our own retrofit device that we wanted to sell ourselves, then that would be, we would put that through. And that probably, on the needle guidance one, would be in the field, probably would be de novo, as opposed to a 510K approval. But we're still confident that the knowledge that we have and where we are in that process, that we will be able to get them through in a satisfactory time.
That's great. Thank you very much. Cheers, Stuart.
Thank you.
Thank you.